Apollo Endosurgery had a really fascinating beginning. It started actually between a collaboration amongst 5 world-leading institutions in healthcare, including the University of Texas Medical Branch, the Medical University of South Carolina in Charleston, Johns Hopkins University, the Mayo Clinic, and Chinese University of Hong Kong. And these 5 institutions and several key physicians there wanted to transform the world of gastroenterology. And so identifying new ways, not just to diagnose patients who have GI cancer-related problems or obesity-related problems, but also to provide a way to treat those patients as you're diagnosing them in a less invasive way. So we make long, flexible tools. These tools do similar functions as existing surgical tools do. So we have tools that suture, we have tools that cut, we have tools that deliver energy. But unlike other surgical tools that require an opening in the belly to gain access, these tools can mount on standard flexible cameras, go through a patient's mouth, and enable therapy in ways that were never done before. So this way, as opposed to having an open or laparoscopic surgical procedure, you can now have that same procedure done without any scars in a much less invasive technique. Patients benefit a variety of different ways from these types of procedures. So, for example, in gastrointestinal cancers, we have techniques now that enable a patient who has an early stage lesion in the esophagus, the stomach, or the colon, for example. Those lesions can now be removed endoscopically using a flexible camera and the tools that Apollo provides, thus helping the patient avoid a very invasive surgical procedure where a large portion of their anatomy would be removed. So Apollo has a lot of different and deep connections with the University of Texas system in different component institutions.